thanks everybody for coming out. We all really appreciate it. 5 rectal exams? I did 30 yesterday. There it is right there. Yeah. That thing about washing your hands is really, really important, as my wife tells me, every single day, twice a day. So I'm a urologist at Holland Hospital, part of Lakeshore Health Partners. There's actually 4 of us in the group, and we spend our time at Holland. We go to Zeeland Community Hospital. We're going up to Grand Haven now, so there's nothing we don't do. Any urologic malady, we can take care of you. Personally, I do most of the men's health stuff in our group. I also see women and kids, but men's health is what I'm really interested in. So one of the big things I'd like to see, too often, the 55-year-old guy rolls into my office. He's a little overweight, his blood pressure's up, doesn't exercise, he smokes a little bit, and he's coming in talking to me about his erections. I want to get those guys in their 20s and 30s. Because as Dr. Myers said, heart disease kills a lot of people in their 40s and 50s. And erectile dysfunction is an important thing when it comes to that. But getting people in early, I think, is really, really important. You know, women do a really good job of promoting their health and developing in these women's health centers. There's that big women's center down in Grand Rapids. And, you know, we need a men's health center here with beer and meat. And we can talk about digital rectal exams and erections and things like that. So my key thing is let's start early. Let's get people in early. Let's be preventive and talk about wellness and health. We need to focus on things like diet. I think diet is one of the key things. My wife is this militant vegetarian, which really bugs the heck out of me. And I come here and I'll get my meat and she'll never know. But diet's really, really important. A healthy diet, you know, avoiding fast foods, avoiding processed foods, I think is extremely important. Exercise, as Dr. Hilton talked about, is tantamount. Getting out there and doing the things that are regular doesn't mean you have to train for a triathlon or run a marathon or do things like that. But getting out and being active and being outside is important, both in the summer and the winter. Sleep habits are really important. I think we're just really understanding what sleep means to us. A restless night doesn't make for a next day that's productive and healthy, and sleep habits are really important. As part of this men's health center, I think we should partner with the sleep labs and mattress companies and things like that and talk about these devices that we can use at night that monitor our sleep. I think that's really important. Stress reduction is also really important. It's sort of a nebulous thing to say, but reducing stress, however you can do that, whether it's meditation or exercise or reading a book or just looking at the ceiling, whatever works for you works for you. Stress reduction is really important, and I know that firsthand. So let's talk about sex. Again, we got the meat, we got the beer, we're talking about sex now. Erectile function, erectile dysfunction is such an important thing in my mind. I can tell you that I think that your erectile function is a barometer of your overall health. And when you talk about people dying of heart disease in their 40s and 50s, you look at the data says that the majority of those people had preceding erectile dysfunction. And understanding that erectile dysfunction is a risk factor for other vascular diseases is really important. And if you think about it, it's logical. For all intents and purposes, that we have these little small blood vessels that feed the penis that are about 1/3 the size of the blood vessel to your heart and about 1/5 the size of the one that goes to your brain. If your blood vessels are clogged down here and you're not getting an erection, it's happening here and it's happening here. So if you can't get an erection adequately, you should talk to your physician about it. And your physician, from my standpoint, should talk to you about it. I talk to every single one of my patients about their erectile function. And some look at me sideways like, what the heck? But it's an important thing. So understanding your erectile function is extremely important. And I do think that erectile dysfunction can be a barometer of your overall health. It's one of the things that I see daily. Half of the patients I'm seeing in my office are guys coming in with erectile dysfunction. And treating that disease is relatively easy. It's not, I can tell you that there's nobody I can't give an erection to. If you can't get an erection, I can give you one. It's really not that, it's not that difficult. And it may not be just as easy as giving you a tablet of Viagra, which is now $50 to $75 a pill. There are other things that we can do to correct that issue. So the bottom line there, talk to your physician about your erectile function or your erectile dysfunction. It's really important. Another hot topic that I deal with a lot is testosterone. And I can tell you, first and foremost, testosterone is not the fountain of youth, and it shouldn't be thought of that. The thing I don't want to see are guys coming in who've got the gut and they want to go on testosterone to lose the gut. It doesn't work that way. The American Urological Association just came out with their guidelines. We've been giving testosterone for a long time, correctly and incorrectly. We've been following men on testosterone for a long time, correctly and incorrectly. But the American Urological Association, our guiding body of health in urology, just came out with their guidelines. And this was something that was developed over about 5 years. A lot of discussion about who needs to get tested, how do you test patients, how do you treat patients, and how do you follow patients. All of that is extremely important, and we go by these guidelines verbatim. The insurance companies do too, and the insurance companies aren't going to pay for your testosterone or your testing unless I do things correctly. You're going to get a big bill, and it's going to be a nuisance, and you're not going to be any bit better, and you might be a little bit worse. There's a lot of myths about testosterone as well. There's myths about risk factors for cardiovascular disease. I don't think that stuff has been sorted out completely. Some of the early data would suggest that if you put men on testosterone, they have higher risks of heart attack and stroke. More of the data is coming out now that would refute that. I think there's still a lot of work to be done to figure out testosterone and what we should do. From my standpoint, when I see a patient who might have symptoms of low testosterone, I go through that symptom score with them very carefully. Understanding their symptoms is just as important as measuring their blood work. And then I test them on 2 different occasions to look for a testosterone level that's got to be less than about 300 or 350 is the guiding level. If their testosterone's low, if they qualify based on their symptoms, we talk about testosterone replacement. And there's really 3 ways to do that. You can come into my office and I can give you an injection every 2 weeks, which the insurance companies like because it's dirt cheap. But when you think about it, it's not really a physiologically normal way to support someone's testosterone. You get kind of a burst of testosterone and it trickles down over the next couple of weeks. Some patients actually it trickles up for about a week and then trickles down for a week. And other people metabolize their testosterone, their injectable testosterone a little bit differently. That's one option. A second option is a cream that you can put on your inner thigh or under your arm or on your chest. That's good, and you're getting it every day, but it's got to get through your skin, and your skin's a barrier. 25% or so of patients don't absorb that testosterone very well, and it's expensive. There are ways to get around that expense, but if you don't absorb it, you're not going to get it. The other thing is you can get it on your significant other. So if you slather on your testosterone every day, 3 times a day, and your wife has to start shaving in the morning, something's not right. So you have to be careful with testosterone. It's not that it again is something you have to be careful with. The last option is to put these little pellets under the skin of the buttock, and that's a quick and easy thing that I can do in the office. I numb you up. I put these little pellets in. The pellets will slowly secrete testosterone over about 6 months. Again, aside from the treatment, follow-up is really important as well. I see a lot of patients that go to these clinics where they get their testosterone every 2 weeks, and I say, well, what's your testosterone level? Where's your PSA? What's your hematocrit doing? And they said, well, I haven't had blood work in 2 years. And that's not a good thing. So careful testing up front, talking to people about their symptoms, treating them appropriately, appropriate follow-up is really important for testosterone replacement. What about the prostate? Dr. Myers touched on the rectal exam and the PSA and things like that. We see both benign and cancerous prostate issues. The benign stuff, all related to enlargement of the prostate, slowing of the urinary stream, more frequent urination, getting up at night, wetting your pants. You wet your pants, you're going to come into my office. You'll bang on my door to get into my office, I guarantee you. Because that's not a good thing when you're out there and all of a sudden you have an accident. That's a sort of a humbling episode. But we can treat prostate disease relatively easily with medication and with some relatively minimally invasive surgical techniques in the office that take 5 minutes for the appropriate patient. We can also take you to the operating room and do the roto-rooter job. As far as PSA and cancerous prostate issues go, I think it's really, really important that PSA be interpreted correctly. It used to be a knee-jerk thing. You had your elevated PSA, you came in, and you got a biopsy. And that is essentially lying on your side with 2-finger ultrasound probe in your rectum for 5 minutes and 13 needles. So nobody wants to do that. So if we interpret PSA correctly, we limit biopsies, we limit the diagnosis of prostate cancer that may never cause problems and ultimately lead to treatment that creates problems. So we really have to interpret PSA correctly. And there's no norms in PSA. I look at change in PSA over time and PSA compared to the prostate size or PSA density as being the parameters that would suggest that a patient might need a biopsy. So having a regular rectal exam, getting the PSA checked and interpreted correctly is really, really important. And treatment of prostate cancer isn't an all or nothing phenomenon. There are many cases nowadays where I have a number of patients who we just follow expectantly, meaning we're following their PSA, they have a diagnosis of prostate cancer, we're not actively treating them, we're just following their disease. So from a urological standpoint, a men's health center is a no-brainer. I need the primary care guys and cardiology to be a part of that. And it's to get you guys in early so we can keep you healthy, so you live a good life and you're not dying of heart attacks and strokes at the age of 40 or 50. You have a good, active sex life and you're keeping yourself healthy. Thanks a lot.